CVS questions 3. 17. A client's serum calcium level is 7.9 mg per dl. The nurse is immediately concerned knowing that this level could ultimately lead to which of the following? 1. High blood pressure. 2. Stroke. 3. Cardiac arrest. 4. Urinary stone formation. The correct answer is 3. Cardiac arrest. 18. A nurse is reinforcing instruction to a client with hard block about the fundamental concepts about the cardiac rhythm. The nurse explains to the client that the normal site in heart responsible for initiating electrical impulses is which of the following? 1. Arterioventricular node. 2. Bundle of His. 3. Purkinje fibers. 4. Sinoarterial node. The correct answer is 4. Sinoarterial node. 19. A nursing instructor asks a nursing student to describe the structure and function of the coronary arteries. Which of the following response by the students indicate a need for further research, anatomy and physiology related to the heart? 1. The coronary arteries branch from the aorta. 2. The coronary artery supplies the heart muscle with blood. 3. The left coronary artery provides blood for the left atrium and the left ventricle. 4. The left coronary artery supplies the right atrium and right ventricle with the blood. The correct answer is 4. The left coronary artery supplies the right atrium and right ventricle with blood. 20. A nurse is assigned to care for a client with a cardiac disorder and is told that the client has an alteration in cardiac output. The nurse plans care understanding that the heart normally sends out how many liters of blood per minute to your body? 1, 2, 5, 3, 10, 4, 15. The correct answer is 2, 5. 21. A nurse is teaching the client with angina pectoris about disease management and lifestyle changes that are necessary in order to control disease progression. Which statement by the client indicates a need for further teaching? 1. I will take nitroglycerin whenever chest discomfort begins. 2. I will use muscle relaxation to cope with stressful situation. 3. It is the best to exercise once a week for 1 hour. 4. I will avoid using tablet salt with meals. The correct answer is 3. It is best to exercise once a week for 1 hour. 22. A nurse is caring for a client with a has lost significant amount of blood because of complication of a surgical procedure. The nurse understands that which of the following client measurement will provide the earliest indication of a new decreases in fluid volume. 1. Pulse rate. 2. Blood pressure. 3. Presence of edema. 4. Lung crackles. The correct answer is 1. Pulse rate. 23. A home healthcare nurse is visiting elderly client whose family has gone out for the day. During the visit, the client experiences chest pain that is unrelieved by 3 sublingual nitroglycerin tablet given by the nurse. Which action by the nurse would most appropriate at this time? 1. Notify family members who is next skin. 2. Inform the home care agency supervisor that the visit may be prolonged. 3. Call for an ambulance and transport client to the emergency room. 4. Drive the client to the physician's office. The correct answer is 3. Call for an ambulance to transport the client to the emergency room. 24. A nurse is preparing to take an apical pulse on signed client. The nurse places the diaphragm of the stethoscope at which cardiac site? 1. Right atrium. 2. Right ventricle. 3. Mitral area. 4. Pulmonic valve. The correct answer is 3. Mitral area.